Okay.
So our research question is, what is the effect of lower nurse-to-patient ratios in comparison to higher nurse-to-patient ratios on patient quality of care and safety in the hospital setting? Nurse staffing has an impact on the quality of patient care in hospitals. Lower nurse-patient ratios, such as California's mandated 1 nurse for every 5 patients, have been shown to reduce mortality by 50%, though there has been little reform in nurse staffing. Nurses across the world cause miscare due to an overwhelming number of patients, including one report of 11 patients to 1 nurse on average. Staffing that leads to these high ratios can lead to adverse patient outcomes, such as pressure injuries, and cost hospitals over $9 million. High ratios can also have an impact on their health and well-being of the nurse. It can increase nurse burnout and shorten nursing careers, and therefore contributing to the high ratios and result in chronic fatigue, poor sleep patterns, and job dissatisfaction.
Some of the practice implications reads, quality of care is a cornerstone of the nursing profession, and as nurses, it is our responsibility to ensure we consistently strive to improve upon that quality. The literature review has shown that staffing ratios have a significant impact on not only quality of care, but patient safety as well. It is essential that nurses have adequate staffing ratios in order to prevent things such as nurse burnout and omitted care due to time constraints, as omitted care can lead to adverse patient outcomes. Adequate staffing has been shown to reduce complications such as mortality, pressure injuries, pneumonia, and infections. These events not only have negative impacts on patients, but nurses as well. Omitted care can lead to even more work for the already stressed nurse and lead to the nurse leaving the facility and/or professions, therefore creating a vicious cycle. As nurses, it is important that we advocate for patients and ourselves by advocating for adequate staffing ratios.
In conclusion, nurse staffing ratios have a substantial impact on a nurse's ability to provide quality care and maintain safety. The results of this literature review showed that inadequate or decreased staffing can lead to missed patient care activities and subsequently poor patient outcomes and safety. Alternatively, having adequate staffing or staffing has been shown to significantly decrease the incidence of mortality, medication errors, and restraint use. Adequate staffing and a better work environment was also shown to improve at-risk patient outcomes. High nurse-to-patient ratios impede the ability for a nurse to communicate with patients to create individualized care, which is crucial to the nursing process theory.